How does hypertrichosis differ from hirsutism? Imagine a person covered in hair from head to toe, or hair growing in places it normally wouldn't. That's what makes these two conditions so fascinating. Both involve excess hair, but they are very different in how they happen and who they affect. Hypertrichosis is a condition where abnormal hair grows anywhere on the body. It can be present from birth or develop later in life. Sometimes it covers large areas or the entire body, and other times it's just in one spot. The hair in hypertrichosis is often finer and lighter than normal hair, but in extreme cases, it can be very thick and dark. This extreme form is sometimes called werewolf syndrome because of the thick hair covering the body. It can be caused by genetic factors, certain medications, malnutrition, or illnesses like cancer. It affects both men and women of all ages. Hirsutism, on the other hand, is a condition that only affects women or people assigned female at birth. It causes coarse, dark hair to grow in areas where men usually grow hair, like the face, chest, back, or lower abdomen. Hirsutism is caused mainly by high levels of male hormones called androgens, like testosterone. This hormone imbalance can come from conditions like polycystic ovary syndrome or other hormonal disorders. And like hypertrichosis, hirsutism is limited to specific areas and is usually linked to hormone levels. Men generally do not notice hirsutism because their normal hair growth patterns are different. The causes are different too. Hypertrichosis can happen without any relation to hormones, often due to genetics or medications. Hirsutism is directly caused by increased androgen hormones or increased sensitivity to these hormones. The patterns are also different. Hypertrichosis can affect any part of the body and can be generalized or localized. Hirsutism affects only areas associated with male hair growth patterns. Who gets affected is another key difference. Hypertrichosis can affect anyone, regardless of age or gender. Hirsutism mainly affects women and people assigned female at birth. The hair itself also varies. Hypertrichosis hair can be fine or thick, light or dark, depending on the case. Hirsutism hair is usually coarse and dark, matching typical male hair. When it comes to treatment, they are different too. Managing hirsutism often involves medications that balance hormone levels and hair removal methods. Hypertrichosis treatment may include addressing the underlying cause if possible and using hair removal techniques. Did you know that the most extreme form of hypertrichosis, called congenital terminal hypertrichosis, was once called werewolf syndrome? People with this condition had thick hair covering their entire bodies and were sometimes shown in sideshows because of their unusual appearance. This shows how some anatomical anomalies can become part of cultural stories and perceptions. So, while both hypertrichosis and hirsutism involve extra hair, they are quite different in their causes, affected areas, and who they impact. Understanding these differences helps in recognizing and treating each condition properly.